Hello everyone, this is question 28 of our 100 clinically oriented anatomy questions. Let's get straight into it. The question says, a 22-year-old male martial arts competitor was examined by the clinician because of pain and serious disability suffered from a kick to the side of his knee. Physical examination revealed a dark bruise just distal to the head of the fibula. Which of the following muscles will most likely be paralyzed? Option A, tibialis anterior and extensor digitorum longus. Option B, tibialis posterior. Option C, soleus and gastrocnemius. Option D, plantaris and popliteus. Option E, flexor digitorum longus and flexor hallucis longus. So going back to the question, I've underlined the most important thing that we need to focus on, which is a dark bruise just distal to the head of the fibula. So which structure is distal to the head of the fibula? It is definitely the neck of the fibula. So the neck of the fibula is the structure that is distal to the head of the fibula. And then a dark bruise that appears distal to the head of the fibula, that is a dark bruise that is suspected or that appears on the neck of the fibula, is pointing to an injury to a nerve. So which nerve winds around the neck of the fibula? It is the common peroneal nerve. So it is at the neck of the fibula, the lateral aspect of the neck of the fibula, that the common peroneal nerve bifurcates into the deep peroneal and the superficial peroneal nerve. So the deep peroneal nerve goes to supply the anterior compartments of the leg, and the superficial peroneal nerve goes to supply the lateral compartment of the leg. The anterior compartment of the leg contains four muscles, and the lateral compartment contains two muscles. So the four muscles that are present in the anterior compartment of the leg are the tibialis anterior, extensor hallucis longus, extensor digitorum longus, and the peroneus tertius muscle. Those are the four muscles that are present in the anterior compartment of the leg, and these muscles are primarily responsible for dorsiflexion of the foot and extension of the toes. And then the lateral compartment supplied by the superficial peroneal nerve, you have the fibularis brevis and the fibularis longus, or the peroneus brevis and the peroneus longus. And these two muscles are responsible for eversion of the foot. So let's go to the question and identify which muscles will be paralyzed due to an injury to these nerves, to either of these nerves. So keep in mind the common peroneal nerve was the one that was actually affected. So it means both the anterior compartment muscles and the lateral compartment muscles will be affected. So option A says tibialis anterior and extensor digitorum longus. Tibialis anterior is a muscle of the anterior compartment. Extensor digitorum longus is a muscle of the anterior compartment. It means both of these muscles will be affected, thereby an injury to the common peroneal nerve. So the correct answer is option A, but let's check the other options before we make our conclusion. Option B is the tibialis posterior. The tibialis posterior is a muscle of the posterior compartment of the leg, and the posterior compartment of the leg, the muscles there are innervated by the tibial nerve, and they're responsible for plantar flexion and flexion of the toes. So tibialis posterior is responsible for plantar flexion, and it also aids in inversion of the sole or inversion of the foot. Soleus and gastrocnemius are major plantar flexors of the posterior compartment of the leg. Plantaris and popliteus are also muscles of the posterior compartment of the leg. The plantaris supplements the triceps surae. Triceps surae is made up of soleus and gastrocnemius. So plantaris, together with the triceps surae, helps in plantar flexion of the foot basically. While the popliteus helps in unlocking of the knee. That's what it does. Um, of course, it's also supplied by the tibial nerve. Flexor digitorum longus and the flexor hallucis longus are the two muscles are posterior compartment of the leg muscles, and they are supplied by the tibial nerve. So all the muscles here, that is from option B to option E, are supplied by the tibial nerve, and option A is supplied by the deep peroneal nerve, a branch of the common peroneal nerve, which means option A is the correct answer, which makes option A the correct answer in this case. So I believe that was explanatory enough and you enjoyed the video, and I'll see you in the next episode. Thank you.